What if you could negotiate your employment contract in the same way that agents for pro athletes do? Well, we're going to dip into that a little bit today on Practice Care. I'm Carl White, principal at Mark Advisory Group, which is a healthcare marketing agency, and I'm also the host of Practice Care. And the mission for both is the same. It's to help private practice owners stay private. Not only is that what they want, but I really believe that care is just better when it's you and your doctor sitting at the table trying to figure out what's best for you. And nobody else is secretly whispering in the provider's ear what their own agenda is. Not a hospital or a health system, not owners in faraway places, just you and your provider. And today, my guest is Ethan Nkana. After more than a decade in hospital and healthcare administration, specializing in physician contracting and compensation, Ethan recognized that his skills, training, and expertise could be put to more meaningful use negotiating physician contracts on behalf of physicians. The extensive experience Ethan has in physician contracting is founded on a doctorate degree in law from the University of Dayton. And while completing his legal training, he also got himself an MBA also at the University of Dayton. And on top of that, he has a Bachelor of Science in Business Administration and Public Relations from Southern Adventist University. Ethan, thanks for coming on Practice Care.
Carl, I am delighted to be here with you today.
It is good to have you. So we're going to talk about doctors and employment contracts and negotiating. And let's just start with a question just to get it out. In your experience, Ethan, are doctors good negotiators when it comes to themselves and their contracts?
That's a loaded question. So I'll say it this way, Carl. Doctors negotiate every single day with their patients. They negotiate with us to do things we don't want to do. Eat healthy, not smoke, not drink too much, take care of our cholesterol. And they don't have any leverage really in the conversation. And so I often share with doctors that they are good negotiators because they get their patients to do things they don't want to do, which is in the best interest of the patient and the doctor. However, now that is very different in the context of contracts and salaries. And so, yes, doctors are good negotiators, although they are not particularly experienced at applying that skill in the context of contracts and salaries.
Well answered. Yes, well answered. It's a totally different environment, and right, the environment and the situation in which you are doing the negotiation certainly matters. So let's get into just sort of a very basic question, I think. So Dr. X goes to negotiate their contract for, either they own the practice and they're trying to negotiate with a hospital, or, as an employee perhaps. Can you just describe for us, paint a picture of, the profile of the person that they're going to be sitting at the other side of the table negotiating with, right? Because it's very unlike the patient that you were just describing a second ago.
Yeah, that's a great point. And to amplify the point that you're making, Carl, the people on the other side of the table in contract discussions typically look a lot like my profile. They typically have business background, some type of business education, experience working in a hospital, and then ultimately, frankly, they may have some type of advanced education, not unlike myself. Mm-hmm. So I often share with doctors, I am as good at providing medical care as you are at negotiating contracts. Because likewise, you're not skilled at contract negotiation, salary negotiation, or how to interpret a contract. However, I'm not skilled at caring for patients in a medical way. And so, frankly, there's just a mismatch of skills when doctors come to the negotiation table with the suits, that I like to call them, the executives,
right?
Because those people, when you think about how many times in your career a physician might negotiate a contract, maybe it's 4, 5, 6, or 7, but for executives in the hospital setting, it could be weekly, or it could be, for some folks, it could be that's their core job. And so it's just unreasonable to expect doctors to be as skilled as their hospital executive counterparts at contract and salary discussions.
Right. So Dr. X, you're going to do this once every, say, few years, but the other side of the table is doing it every day.
Exactly.
So who would you place the bet on to get the better deal? you know.
Precisely.
Yeah. So, you know, the other way to think about these couple of questions I just asked you is, should doctors ever negotiate for themselves? Of course, they are welcome to, but is that really a, you know, a fair, is it really a fair fight? I don't like the word fight, but for lack of a better way of saying it. So another option is you hire an employment attorney who also does this frequently. That's not you. You describe yourself and what, at least the way in which you approach it, as more like a sports agent, you know, trying to get, you know, a professional athlete the best deal to go to this team or that team, and that's what you bring. So can you just kind of, for our listeners, compare and contrast so they can understand the difference between what you do and what, because first time we met, I'm like, you know, compare what you do to an attorney, and you had a really cool answer, so I don't want to steal the thunder, but yeah, just kind of take us through that.
Yeah, you put a lot of pressure. I don't know if I have a full answer for it, but I'll just give you my perspective
Well, the
on the
thought was
matter.
very cool, so you can word it differently, it's fine.
So, ultimately, attorneys, and to be sure, I work really closely with attorneys. I went to school with them, I trained with them, and I lean on them on a very regular basis. And frankly, I had lunch with one of my attorneys yesterday. And the work that attorneys typically do is contract evaluation, analysis, negotiation, but they typically will look at the four corners of that contract. So if a doctor hires an attorney, typically the attorney will say, let me see your contract. The doctor provides a contract and the attorney will provide a rebuttal. The really good ones will not just do the legal and the business analysis, but they'll also look at your compensation to determine if it's in line with the market. Now, here's where, there's kind of a gap between what I do and what the attorneys do. And frankly, I kind of pick up where they leave off. And if I can just share a story, maybe
Yeah,
that will help
please.
illustrate,
Yeah.
that'll illustrate the point. So typically attorneys help doctors negotiate contracts, as I mentioned, within the four corners of the contract. That means anything that's on that paper. The work that I do is a little different. So about a year ago, I got a call from an attorney here in town, and he reached out and said, I have a group of 6 OBGYNs who want to go private practice. And I said, well, that's a big undertaking from going employed. So tell me more. I ended up learning more about the physicians. I spent a little bit of time with them. And when we sat down, I learned that it wasn't so much that they wanted to go private practice, is that they were frustrated with with the discussions they were having with their employer, that they weren't making progress. And so what I do is, when the lawyer had provided some recommendations that the employer had essentially declined on soundly on all fronts, what I did then was I picked up from there and said, okay, fine. If the employer is not interested in having a conversation, let's just see if their competitors are. And so I went across the street and talked to all of the hospitals in town and said, I have these amazing OBGYN physicians who are looking to be paid appropriately. Who's interested? And spoiler alert, everybody was. And so the reason I share that story is because it's important to know that the attorneys are a valuable resource when it comes to managing your risk, making sure that your contract has everything in it that you need, and making sure that T's are crossed and I's are dotted. What I do specifically is help identify other opportunities to create leverage for you. So typically, one of the first questions I ask my clients is, if you go to your employer and say, these are my requests, and the employer says a resounding no to everything, what's your next move? If your next move is, well, I guess I just suck it up and stay, then maybe we're not the best fit. But if a doctor says, well, that's not right, I'd like to explore my options, then all right, now we can work together. And so it's really important for doctors who work with me to know that when you work with me, it's typically to get a salary raise. Like, that is your key goal, as opposed to you can work with an attorney at any time to say, I need a legal review of my contract or my job situation to determine if it's appropriate. But really, I focus on pay, salary, compensation, bonus packages, and benefits.
Okay. And when you say, look, you have to be dissatisfied with just taking what the employer says, like, they have to really believe that they're going to, possibly go somewhere else, right? I mean, if it's not an option, it doesn't have leverage unless you're serious about it, right? I mean, there's bluffing, but I mean, you really got to be ready to go. I mean, right?
You're absolutely right. And one of the things I often tell my docs, and the reason that question is so important is because I don't bluff. So if I work with a doctor and we approach an employer, if we are considering creating leverage, you must be willing to consider your options. Now, it doesn't mean you have to move, right? It just means that you need to be willing to consider your options. Those OBGYNs I was just mentioning a moment ago, they ended up re-signing an agreement with their current employer. They got $1 million to do it, which was awesome. But the point is, you have to be willing to consider another option in order to truly have leverage in the discussion. And frankly, there are many doctors who just say, I'm not willing to look at other options, fully understanding they're underpaid by the market to the tune of 6 figures.
Wow. And in that story, I'm curious, like how quickly did the current employer say, oh, wait, okay, let's talk. Let's reopen the discussions and talk.
The script is the same every single time.
Really?
I approach an employer and the first thing I say is, I'm Ethan. I've been retained by physician X. I'm interested in having a conversation about their compensation and salary. Employer invariably says some variation of not interested. Dr. X is paid just fine.
Okay.
Okay, I understand and I thank you for your time. And so what I then do is I go get offers. So for those OBGYNs, we ended up getting 4 different proposals from competing health systems for a lot more money. So the funny thing is, while they got $1 million per year more as a result of our negotiation together, that was less than what they could have got by going somewhere else.
Really?
And so while my compensation is tied to the physicians, my incentive and my interests are married to the physician. So if a physician says, I want to go to the place that pays me less, fully understanding that it's a more fulfilling work environment for me, then that's what we're going to do, because the only thing I care about is what matters most to the physician, not about, I don't get paid hourly. So it's not about billable hours or, making sure that I get a bunch of money from the doctor. Really, it's about making sure the doctor's interests are represented and advanced.
Okay, excellent. And another question I asked you before we started, so I'm going to ask it again, is negotiating before your contract comes up, is that feasible, possible? Is that a thing, or you just have to kind of wait for, your renewal date and get ready at that point?
Yeah, you can negotiate anytime. And if you couldn't, it would be a really untenable situation, because you would have doctors locked in 10-year agreements and they can't make life changes. So I often tell doctors, if you believe, understand, or are curious as to whether or not you're underpaid, start your research now. Ask the question now. Call me now. Don't make that something that you let linger just because you don't have a contract renewal coming up. So that can be done at any time. It's most easily done, of course, at contract renewals, but it can be done at any time.
Right. Okay.
After, just to put a fine point on that, anytime after 1 year of a contract. So you have to fulfill 1 year of your contract, and then anytime after that, you can make a change.
So that's like a sort of a nationwide kind of, is that part of a contract? Like you got to stick it out for a year?
Yeah, I don't want to misspeak on exactly. I believe it's Stark or anti-kickback. But if I know that if I commit to either of those, I'll be talking out of school. But it's a regulation. It's not even kind of a policy. Like, it is a regulation that you cannot, that you just can't do that. Like, that is not allowed.
Right. Fair enough. And I'm curious, like, I know it always varies, but how much time in advance should a doctor think about renegotiating, however they do it, whether it's you or an attorney or anybody themselves, how much time, because you don't want to just walk in one day. I mean, and nobody does that, but what's a good time frame for just proper prep?
I often say the sweet spot is 90 days to 120 days. So 3 to 4 months is really that sweet spot. So just to illustrate it, if my contract were to expire on August 31st, I would want to begin that conversation around the month of May.
Okay.
That would be the ideal spot.
Okay.
The absolute minimum amount of time you could probably pull something like that off is about a month. So 30 days to 45 days. And the longest doctors tend to work with me is 6 months.
Okay. And then once everything's sort of signed, sealed, and delivered, so to speak, then the job is done. And then that's, until next time, I guess, right?
Yeah, my job is, I'm kind of a mercenary in that respect, where my job is to help you get a bunch of money and start your new job or continue the job that you've had and continue forth and prosper. So, to your point, it's, I really kind of come in, get the job done, and then like to see you right off into the sunset.
Yeah. Now, one of the things you said a few minutes ago is you kind of have to know. So if you believe you're paid under market, you have to have some source of what the market is. You just ask your colleagues, or are there sources? Like how do people even, when I was in corporate, the last thing, you ever wanted to do is ask a colleague what they were making. I mean, aside from it's just an awkward question, it's just a very awkward question. It's really frowned upon. So like, how do you find that out?
Frowned upon by whom?
By the people who don't want you to know. Now that
Exactly.
you ask it.
Exactly.
Nobody can see this. You're listening. Big smile on Ethan's face right now. I walked into something really
it's
nice
a
there.
right smile.
Yeah.
I kind of walked you into that one for the reason that we have this belief that we shouldn't talk about our salaries and compensation, and frankly, that comes from the people who hold the keys. That does, it benefits us as the worker to talk about our salaries. So now, just to be sure, this is a separate discussion from how do you figure out what your salary should be. Like, I do think it's important for you to talk with your colleagues about your salary, because unfortunately, there are substantial disparities, even in physician compensation, where women earn between 20 to 25% less, which can come up to about $100,000 in some cases. And there are also disparities along racial divides. And so it's really important, I think, for doctors to talk about their salaries, because it will illuminate some of the inequities that aren't public.
Yeah.
Now, to transition into the second part of your question, which is, well, if there's a disparity, how do these doctors, pregnant pause, because I want to recollect my thoughts.
Fair enough.
Can you ask me the question the way you asked me again? Because I think it's a good one. I don't want to come away from how you asked it.
What did I ask? Do you ask to collect salary information? I'm not asking.
Yeah, you ask your colleagues.
Yeah. Okay. Yeah. So, are you?
Yeah, I'm ready.
Yeah. Okay. So how do you find out, what the market rate is? Do you just start asking do you start asking your colleagues? I mean, there's got to be third-party sources out there, but one data input is asking your colleagues, but nobody ever wants to ask. It's just this taboo subject. So what do you do?
Yeah, Carl, I think it's really important to go to the source. So in my career, when I was a W-2 employee, anytime I went to my boss or the leadership about my compensation, it wasn't on a whim. I had done my research. I'd gone to the source. For physicians, there are very specific sources of insights around salary and compensation. In my career, I just went to salary.com, glassdoor.com, and instead of asking my colleagues, because here's the problem with physicians,
they could all be underpaid, right?
Exactly. Yeah. That was, and frankly, I do take a very direct approach, which is not always appreciated, but I take a very direct approach in how I communicate and and frankly how I do business. And so when I had come back to my bosses about compensation and looking at my salary, many times they hit me with the classic refrain of internal equity. Well, if we pay you this, then that means you're going to be paid way more than Sally, who's been here for 3 years longer than you. And every single time I said, that's not my problem.
Mm-hmm.
The fact that Sally, God bless her, is not a good negotiator shouldn't dictate my value. My value is derived from my contribution to the organization and the skills that I bring, right? And the impact of my work.
Yeah.
So the same thing goes for physicians. When you were having a discussion about your salary or reflecting on whether your salary is appropriate for the market or in line with your colleagues, go to the source. Mm-hmm. Because what you're betting on, if you ask Sally or Joe next to you, is that they did their research and that they're not underpaid. So it's really important to just go to the source. And and this applies across all industries, whether we're talking about doctors, lawyers, dentists, whomever. You need to go to the source of your salary data for your job description, your skills and background, your years of experience, and you cannot forget your region of the country. Mm-hmm. Cost of living varies widely throughout the country, and that's one of the major drivers in physician compensation. An orthopedic surgeon doesn't make the same in Palo Alto as they do in Morgantown, West Virginia. Mm-hmm. And so understanding how the regional market influences compensation is really important. Again, no matter what job description you have, you need to know what the salary is for your job, skill set, experience in that part of the country.
Right. Excellent. And, we could have a whole second and third chapter of this discussion about, the sort of the must-haves in a negotiation, the win-win like we laughed about, and, the BATNA and the ZOPA, and it's all coming back to me from a course that I took when I was in graduate school. But, the point I just want to make there is if you're thinking of doing this on your own, whoever you are, because you just don't, you think you can, or you think it's not worth it. I don't know if you think you can, I'm not going to judge that one, but it's always worth it, I think, unless somebody's really usurious, because whatever you're going to pay, it's going to pay back. And as long as the person does their job in a higher salary, which then compounds on itself at a larger number. And it just really, this is your compensation you're talking about. You got angry because you weren't getting compensated well. Don't follow that up with, try to do it on your own unless you are really, really sure you can put in the time and you've got the background to do it. One question I ask on every episode, Ethan, is as we kind of wrap up here, now that you've heard our conversation, is there anything you think that our listeners need to know, but I just didn't ask you about, or we didn't say so far?
The really important thing that I want every person I interact with to know, whether it's a doctor or someone else from another discipline, advocate for yourself. Mm-hmm. It is vitally important for you to advocate for your value. And I learned that lesson really early on in my career because I got burned. Mm-hmm. I got burned hoping that people who I looked up to would, take accountability for my career and my success. And the fact of the matter is, if you're waiting for someone else to look out for you the way you would look out for you,
you're waiting a long time.
You're going to be waiting a long time. And so I learned, and frankly, I had to get burned, Carl, to be able to appreciate that lesson. But I learned that ultimately I have to look out for my own career and my own success. And I can't dim my light or apologize for what I'm setting out to be, whether that's professionally or personally. And so if I can just encourage anyone who's listening, maybe you've had a recent experience where you've had to dim your light or you've chosen to dim your light. And if I can just encourage you next time, don't let your light shine and speak up for yourself, because nobody else is going to.
Yeah, I really like how you say that about dim your light, shine your light. I really like that. I haven't heard it said that way before. It's nice. Okay, final question then before we wrap up is, so somebody who they're listening to this, they're going, yeah, you know what, I walked out annoyed, or I'm just wondering about the terms of my agreement. What are one or two tangible steps they could take as soon as they're done listening to us talk to get going down on the path? It feels like one of them is start gathering the data. Your area, your experience, start gathering the data on what the market would pay for what kind of looks like you compared to what you're getting paid. Is that a good place to start?
Precisely. You never want to wing it when it comes to your contract and salary. And the reason that's so important is because there's a thing attached to it called political capital. So political capital is an idea, and I'm just going to use the way I understand it, but it really is kind of a bank account of your influence in an organization. And sometimes you have to withdraw from that, and sometimes you make deposits into that. If you go into a contract discussion, and Carl, I saw this countless times in my career. If you go into a contract discussion and you are not willing to follow through on what you're presenting, you will erode your political capital, which means the next time you come to me and say, Ethan, if you don't pay me X, I'm going to walk, I'm not going to take you very seriously.
Because you didn't last time. Yes, it's coming back to me. Prior part of my career, corporate life. And yeah, I mean, and you establishing yourself is during that negotiation phase. I did it. Friends asked me, should I negotiate? Yes, you should. First of all, if you don't do it now, it's never going to come up again. And secondly, and we weren't contract, we were at will, so there was no, but then the other thing is you're forming an impression. You're exactly right, Ethan. You are forming an impression. It starts right there. Like it or not, it's not a happy-feely place. It is a place of business, of medicine, of practice. And yeah, when you're an organization of other people, you are establishing yourself. So if for no other reason, start to form the impression of how you want them to think about you and things that really matter to you, because they're paying attention. Excellent, excellent, excellent. Ethan, this has been a great conversation. Like I said, we could go a lot longer. It's so interesting. But in the interest of bite-sized advice here on Practice Care, we're gonna wrap it up and just say thanks again for coming on. We're going to put all of your contact information in the show notes. And just to clarify, Ethan Nkana, Nkana is a spelling of your last name, but that'll be in the show notes as well. And a couple of final points. If you have an experience, so you own a private practice and you've had an experience with the business side of your practice that you think others would benefit from hearing, we really want you to come on Practice Care. Or if you're somebody like Ethan or myself and you work a lot with those who own private practices or those who work in medicine, and you've got some experience you want to tell, same thing. We want you to come on Practice Care. There's a link in the show notes of every episode, including this one, with where to tell us what your story is about. Please fill it out right away so we can get you scheduled. And then finally, if you haven't done so already, please subscribe to Practice Care on Apple Podcasts or wherever you listen to your podcasts. Thanks very much. And until next time.